Hello and welcome to class. This is Applied Research Project number 1, and this is our week 1 screencast. Well, probably the majority of you do not know me. My name is Dr. Jason Brummett. I'm a professor in the School of Physical Therapy. I've been at George Fox for about 10 years now. During that time, I have served primarily in the School of Physical Therapy, although 1 year I did fill in for the director of the athletic training program. Our director moved on, and I filled in for a year until we got a new director to close out that program. I, just like that time serving as an interim director in the athletic training education program, am serving in an interim role, I guess, here in the PA program. I'm helping out in this one class as the PA program gets a new faculty member for the future. That being said, I do really enjoy research, and I think we will have a good time in this class helping to prepare you to set you up for success as you move through the applied research project sequence here at George Fox. A little bit more about me. I earned my PhD in orthopedic and sports science from Rocky Mountain University of Health Professions. My dissertation was, can preseason functional tests discriminate injury risk in Division III collegiate athletes? So what I was curious about was, could these inexpensive, easy to perform tests, like a standing long jump, like an agility drill test, things like that, could we use those at the start of the season to potentially identify athletes who would go on to experience a non-contact time loss injury during the season? And I was able to get 4 publications from that work. For many years, I carried on and continued on with this type of research, examining different types of tests, doing some stuff in our motion capture lab, things like that. And again, continue to publish in the area, but now I've kind of transitioned to some other areas. One is in blood flow restriction training. And I think there are a few of you in here that participated in one of my studies last year. And if you aren't familiar with blood flow restriction training, it is really interesting. It was a technology developed in the 1990s and even before then by physiologists, many of them doing work in Japan. And basically what blood flow restriction training does is it tricks the body into thinking that it is working out harder than it actually is. So by occluding blood flow, as the picture shows there, the individual has the tourniquet applied to the leg. It is occluding about 80% of the arterial inflow and occluding 100% of the venous backflow. So by doing that, it creates this physiologic trick, and it allows the individual to work out at a much lower intensity and still achieve the gains that would be associated with working out at a higher intensity. So it's really beneficial for our rehab patients who can't load properly because of postoperative restrictions. Maybe they've had a fracture and so they have limited weight bearing that they're allowed to do. Or maybe it just causes them pain to lift heavy. So that's what I've been working on a lot lately. And I'm also moving into doing research where I'm going to be combining supervised exercise with health coaching for patients with chronic health conditions. Finally, I do some clinical work. I do per diem work for a few different companies. One company that does outpatient orthopedic physical therapy is ATI. I also do some work for Concentra. Concentra provides outpatient orthopedic work for work comp individuals, or I should say individuals who have had a work injury. And then finally, I also do some skilled nursing facility work for Consonas. Okay, so that's a little bit about me. Going to find out more about you here shortly. But before we get to that, let's take a look at our course syllabus. So if you want, you can download the course syllabus from Canvas. My information is listed there, my phone number and my email. Please feel free to drop by. Happy to meet up with you anytime. Obviously, you've got a pretty busy schedule. And so if when I'm around doesn't kind of coincide when you're around, we can always set up a Zoom or we can set up a time in person, and I'm happy to do that. All right, going a little bit further down the syllabus now, let's talk about the course description. This is the first in a series of applied research courses that culminate with the student presenting and potentially publishing the results of their research. In this course, students will learn how to use the PICO format and develop and answer a clinical question and will write a review of the literature. Research methodology will be presented and reviewed with students synthesizing the findings from literature explored during class. As you know, this is an online class. We will be having weekly online class sessions, and the material that will be delivered will be in the form of screencasts like this. You'll also be asked occasionally to participate in forum discussions, do homework assignments, and there are 2 major assignments. There are no required texts for this class, and I do not have a recommended text either. What you might be interested in are the assignments. We have 3 homework assignments, and each week I will present what that's about, when those assignments are and when they're due. We're going to have 6 forums and 2 major assignments. Looking at things week by week, you'll notice that I have the due dates for the different forums or the homework assignments. The arrow pointing to week number 3 here is identifying where I'm going to review major assignment number 1, the PICO question. Then moving a little further along, you'll see in week number 6, that's where we're going to be reviewing major assignment number 2, the review of the literature. Now, I might have those things up available before that time. You can always be on the lookout for that. I'll let you know when new modules are put up, but those are the specific dates that those reviews will be in place for what you need to do for major assignments 1 and 2. Week number 10, that is when major assignment number 1 is due. And in week number 16, that is when major assignment number 2 is due. I want you to take a look here and see that through week 12 to week 16, a lot of class time is being devoted to just working on major assignment number 2. So week 12, week 14, week 15, there will be no new screencast materials during those times. And then, of course, at the end of week number 16 is when you're going to turn in your review of the literature assignment. So again, the major assignments, see week 3 and week 6 for their instructions. And I'm excited to help you with your assignments. I've had an opportunity to publish both critically appraised topics, which utilize the PICO, and also publish both systematic reviews and literature reviews. And I think it's important for me to stress that I do not know your discipline. You, as a PA student, as a future PA professional, I have no clue what it takes to do your job. But what I can do really well is, as I review your manuscripts, the questions that I pose will hopefully be done so in a way that can help this lay individual understand what you're trying to get across. Because that's the big thing as you try to potentially publish your findings in the future. your manuscripts will go through a review process. And in that review process, the people that are reviewing your work may not have your same expertise. So if you're able to get across your thoughts in a way that makes sense to an individual that does not have a background in your field, you're going to be basically killing it. And so I'm excited to work with you on that and to help you in that process. Okay, this week, obviously you've just listened to the course introduction and learned a little bit about me. I'd like to learn more about you now. So please write as much as you'd like. I've got some specific things I'm looking for, but please feel free to write as much as you'd like. And I'm looking forward to getting to know all of you virtually and potentially in person too. All right, talk to you soon.